It'll, all right, so good morning, everyone. Once again, welcome to the Health and Human Services Track Pre-Summit webinar of the 2010 California API Policy Summit. My name is Wendy Ho, and I'm the State Policy Analyst at the Asian and Pacific Islander American Health Forum. I am one of the co-chairs for the Health and Human Services Track of the summit. Today I will be joined by Hala Masri, who is my co-chair of the Health and Human Services Track. She's the state policy advocate at the Asian Pacific American Legal Center of Southern California. And we also have the pleasure of being joined by Santosh Santana, who is the legislative advocate for Asian Americans for Civil Rights and Equality, and also the chair of the Civil Rights Track of the summit. Before we begin into the substantive portion of today's webinar, just a couple of housekeeping notes. For those of you who may have questions during today's webinar, we encourage you to ask us those questions via the question dialog box, which is on your control panel, the webinar control panel on your right. At any point during the webinar, if you have a question, please go ahead and type in your question, and we will be sure to field it where appropriate, and we'll try to get to as many of those questions as the time allows. So with that, why don't we go ahead and get started. I will turn it over to my co-chair, Hala, who will kind of give you an overview of today's webinar.
Great, thank you, Wendy. So we wanted to start out today by providing an overview of what we can expect on today's webinar. And the first thing we wanted to talk about is some of the logistics of the summit, so that going in, participants know what to expect in terms of workshops and legislative visits, and of course so that participants are energized to participate in the policy summit in general. Then we're going to jump into talking a little bit about the policy platform for the Health and Human Services Track. And these are basically a couple bills and a few pieces of the state budget that the track committee has recommended to be prioritized at the policy summit, considering this year's political and fiscal environment. So we'll talk a little bit about those bills and the state budget crisis. And one thing we wanted to highlight was that there's actually going to be a budget hearing on May 3rd, which is the first day of the policy summit. And it'll cover some immigrant-specific programs, some really critical programs, including the Cash Assistance Program for Immigrants, or CAPI, and that provides living assistance to immigrant seniors and disabled immigrants as well, and the California Food Assistance Program that provides nutrition assistance to immigrant families. And it's very possible that that will also include CalWorks, which is living assistance for immigrants as well. So we wanted to bring that up on the webinar today so that we're hopefully able to get support from summit participants. We hope that people can join us, either to testify or to just sit in the audience and show support and fill the room. I will say, though, if you want to testify, it would be great if you could contact me. My phone number is 213-241-0215. Again, that's 213-241-0215. The only reason being is that we want to try and coordinate the testimony as much as possible. And then lastly, we'll talk a little bit about our legislative visits that will happen on the second day of the summit, a little bit about the logistics and what agendas should look like, based on group to group. So, of course, everyone is welcome to stay on for that section, but we definitely encourage team leaders to stay on for that piece. And many of you have already been contacted about being a team leader, so you probably know who you are. So next slide, Wendy. So to jump into the logistics of the first day, and I don't know if that slide has come up yet.
There we go. A little bit of a time lag. Sorry.
No problem. So we're going to start out with registration in the morning, and then at 9:30 we're actually going to start the welcome. And we're going to have a few state leaders come address policy summit participants. And then we're going to jump straight into our first round of workshops. And there's two, I think, important things to note about this year's summit and the format of the workshops. The first being is that the workshops are much more substantive this year. They're very skills-building oriented. So if you've been to the Policy Summit in past years and you've been in workshops where there's panelists and there may be a little bit of discussion at the end, be prepared to expect something different from the workshops this year. There'll be a lot more interactive activities and exercises so that participants really come out of the summit, hopefully, really feeling like they've been able to hone a number of different skills. And the second thing to note about the workshops is that we'll actually have a round of workshops in the morning that will be repeated in the afternoon. So with the example of the Health and Human Services track, we'll have 3 workshops in the morning, and then after lunch, those same workshops will actually be repeated. And the thought behind that was that so often we see participants who are torn between 2 workshops they want to attend in the morning. We figure that by repeating the workshops in the afternoon, people will have the opportunity to attend the workshops they didn't get a chance to in the morning. So after our first round of workshops, we'll go straight into lunch. And during lunch, we want to have caucuses. And what we mean by that is really just an opportunity for participants who work on similar issues to get together, brainstorm, strategize, share best practices about a particular issue. And this will be a great opportunity for people to address issues that aren't necessarily captured or addressed in workshops. So we're looking forward to those caucuses. We're still in the planning process, so we'll let you know what issues will be covered there. After the second round of workshops, we'll then move into leadership and capacity building training sessions. And these sessions are meant to hone the skills of participants, including fundraising, communications, speech, and public speaking. One thing we want to note about this session is that, of course, participants are more than welcome to attend this session, but we also want to highlight the fact that the budget hearing will conflict with this session, and the Policy Summit conveners are very well aware of this conflict, and we are encouraging participants to join us for the budget hearing. And the reason for that is the more that we can fill the room, the more that we can show support for these programs, the better we are in our fight for preserving these programs. So we're going to talk a little bit about that budget hearing later on in the presentation, but I just wanted to highlight that potential conflict. And then lastly, we'll close out the day with the summit reception and summit dinner. Some of you may be registered for that dinner, others not, but that will actually conclude the first day. And with that, I'd like to turn it over to Wendy to talk about what we can expect on day 2.
Great. Thank you, Hala. If I can get the next slide going. There we go. So on day 2 of the summit is Tuesday, May 4th. And what day 2 will really consist of is legislative visits with our elected officials in the state capitol. It will give you an opportunity to apply what you learned in the workshops in day 1 and put it into practice. So day 2 starts off with some legislative team meetings in the morning over breakfast. This will be an opportunity for all of the legislative teams to break out. And all of the teams are separated by track. So the summit consists of 4 tracks. There's the Health and Human Services track, which all of you have registered for, the Civil Rights track, and an education track, as well as a Housing and Community Development track. So on the morning of day 2, you'll be meeting with your legislative teams, and that time is really intended to kind of get organized for the legislative visits that you'll be going on. You'll probably use this time to identify issues that you want to raise with the legislators you will be visiting, and kind of divvying up speaking roles among your team. We'll go a little bit more into suggested format for these meetings a little bit later. So following the team meeting in the morning, there is a block of time from 10:30 to 12:30 for legislative visits. Right now we're scheduling probably at least 1 to 2 visits within that block of time before lunch. There may be more, so just be aware of that. Following the morning set of legislative visits, we'll have lunch, we'll reconvene, and then we'll send you back out again to do another hour of legislative visits. Again, that might be another 1 to 2 visits per team. And then following the visits, we're going to have another meeting with your teams to kind of debrief and kind of figure out if there are any follow-up items that need to be attended to once we all return home. And so after that, we'll talk a little bit about just kind of closing out the summit and reflecting, and that essentially includes the 2 days of the summit. So next, we'll turn to the Health and Human Services Track platform, and this will basically be what you will be advocating for with legislators on day 2. The Health and Human Services Track, myself and Hala and a committee of individuals from across the state who represent different communities have come together to devise a platform with different legislative and budget priorities within the health and human services realm. The items that we have chosen to feature in our platform are based on relevance and timeliness and correlation with each of our track workshops. We know that last year, one of the biggest recommendations that came out of last year's summit was to tie in the legislative and budget priorities into each of the tracks workshops so that they'll be reinforced. And so that's what the Health and Human Services track has done, is really found items that found bills and found budget priorities that we feel will mesh well with each of the workshops that we're offering this year. A lot of the material that we will cover in these next few slides will actually be contained in your binder, which we receive at the summit, so don't feel like you need to take copious notes right now. And again, we will make this presentation and a video recording of the webinar available to you all if you want to kind of refresh yourself before the summit. So I'll go ahead and kind of get started into talking about some of our legislative priorities for the track. So the first bill that we have decided to highlight this year in our track is AB 1737, which is sponsored by Assemblymember Mike Eng. Many of you may be familiar with this bill. It's a bill that would align state-collected data with ethnic groups reported by the U.S. Census. I don't think I need to elaborate on this a whole lot since many of you understand the need for disaggregated data for our communities. Having disaggregated data is imperative for identifying health disparities and the need for critical services like language interpretation. Currently, the state collects data on certain ethnic subgroups, and you'll see those groups listed on the slide. But what this bill would do, it would expand this list of groups to match the list of ethnic groups that are collected by the U.S. Census. Now, this bill would only apply to certain state departments, again, listed on the slide. Not every department, but there are some key agencies, state agencies, and departments that this would apply to, including the Department of Healthcare Services and the Department of Public Health and the Department of Social Services. The bill has already passed out of the Assembly Business and Professions Committee and is now sitting in the Assembly Appropriations Committee in the suspense file. So that's the first bill. Second bill is SB 8356. Which is being sponsored by Senator Jenny Oropeza from the Long Beach area. What this bill would do would restore the Every Woman Counts program, which is a free breast cancer screening and diagnostic services program for underserved women. The state decided to suspend enrollments for this program from January 1 to July 2nd of this year, and also changed the eligibility age for enrollment in this program and restricted it to women who are 50 years and older. This suspension of enrollment has been particularly difficult for our communities. Our Asian American, Native Hawaiian, Pacific Islander communities have had low screening rates for breast cancer, and breast cancer is the most common form of cancer among Asian American, Native Hawaiian, and Pacific Islander women. So, you know, we really feel strongly about this bill. I know a number of you have been working on some advocacy around this bill, so we thought it would be best to highlight and highlight this bill in our track. This bill has actually passed out of the Senate Health Committee and is now waiting to be heard in the Senate Appropriations Committee, and that hearing is scheduled for Monday, actually, the 26th. And so, you know, we might have some good news coming out of Monday, so the status of this bill may change between now and then. The final bill that we have decided to include in the Health and Human Services Track platform is SB 900, which is sponsored by Senator Elaine Alquist, who's the chair of the Senate Health Committee. What this bill would do, it would establish the California Health Benefits Exchange. And as you probably have heard, we passed a little something called health reform that is now law at the federal level. And so this bill is really just a vehicle to implement some of the changes brought about by healthcare reform. So as I mentioned, this bill would establish a California-based insurance exchange. And for those of you who don't know, an insurance exchange is really just a marketplace for insurance plans. This bill is envisioned that it is really just a fundamental building block of kind of getting health reform implemented here in California. It is predicted that this bill, if implemented, would reduce the uninsured rate by nearly 2/3, as you can see, from 8.2 million to about 2 to 3 million. The bill passed out of the Senate Health Committee this week and is now in the Senate Appropriations Committee waiting to be heard. And with that, I will turn it back to Hallow, who will talk a little bit about our track's budget priorities.
Okay, thanks, Wendy. Well, as many of you know, California is suffering from a very severe budget crisis. Our deficit now amounts to about $20 billion, and a little bit less now because we passed a few fixes a couple months ago. But actually, in early January, the governor released a budget proposal that was extremely disappointing. What it did was basically aim to dismantle California's safety net, either through severe reductions or complete eliminations of programs. And the proposal also failed to raise any sources of revenue that might help prevent the elimination or cuts to really critical programs. Next month, we should keep our eyes peeled for the May revise, which is basically another budget proposal that the governor puts out in May after taxes have been filed on April 15th. So we'll keep an eye out for that to know and inform our advocacy in the next coming months. But our fight will have to be very strong this year because the threat to programs every year just gets worse and worse as the budget deficit continues to escalate. And Wendy, if you can move to the next slide. One thing we're doing this year in the context of the policy summit is talking about the cuts, not necessarily as a list of cuts that the governor has proposed, but rather the populations of people that the cuts will affect. So we have focused in on three, what we view as very vulnerable populations affected by the budget crisis. The first one being older adults, the second one being vulnerable families, and the third one being immigrant communities. So our first population is older adults, and the governor has really targeted the older adult population for quite a few years now, as he has with other groups in regards to the budget crisis. And what he wants to do this year is decrease living assistance for seniors and disabled individuals under the SSI program. And he wants to decrease that assistance for individuals. He's already actually reduced the assistance to couples to the federal minimum. So legally, he cannot reduce that assistance any further. So that's why he's going after individuals this year. And then on top of that, he's proposed to eliminate the in-home supportive services program that provides in-home care to elderly and disabled individuals who, because of this care, are able to stay in their home and maintain their independence. One thing to note about this program, and it's true of a couple other programs this year too, is that the governor has proposed a number of different program reductions to the IHSS program. And then in addition to that has said, if we don't receive $7 billion from the federal government in assistance, I also propose to completely eliminate this program. And it's quite possible that we will not receive that much money from the federal government. So the In-Home Supportive Services Program is facing both the possibility of program reductions as well as complete elimination. Next slide, Wendy, please. So our second population is vulnerable families. And similar to older adults, vulnerable families are targeted quite heavily this year. The governor would like to eliminate living assistance to families under the CalWORKS program. And similar to the In-Home Supportive Services program, the CalWORKS program has been targeted for specific reductions as well as complete elimination. So the threats that the programs are facing this year are very scary, and I think it's making a lot of advocates really uncomfortable because they're so severe. The governor also wants to reduce Medi-Cal services, which is a health program for low-income Californians. And while reducing services, he also wants to increase out-of-pocket costs for participants. And he also wants to eliminate the Healthy Families program, which is health insurance for low-income children who don't quite qualify for Medi-Cal. Similar to the CalWORKS program and the In-Home Supportive Services program, it's facing a number of reductions as well as complete elimination. The next slide, Wendy, please. So as you can see, the cuts are very, very, very scary this year, and the same is true for lawful immigrants. What the governor is proposing to do is to basically do away with assistance for lawful immigrants. And the first example being the elimination of living assistance for seniors and elderly, the seniors and the disabled under the Cash Assistance Program for Immigrants, or CAPI. And he also wants to eliminate food assistance for immigrant families under the California Food Assistance Program. In addition to that, he also wants to eliminate living assistance for immigrant families under the CalWORKS program, and he wants to eliminate full-scope Medi-Cal, or comprehensive health services, under the Medi-Cal program. So to provide a little bit of a distinction between the immigrant-specific cuts, for the CAPI and CFAP programs, the governor wants to completely eliminate this program. For the cuts regarding CalWORKS and Medi-Cal, he wants to exclude lawful immigrants for 5 years from those programs. So as you see, these cuts really threaten some of the services that are most critical to our communities, and these programs are life-saving for millions of people across the state, the safety net in general. And so our fight this year is ongoing, and we really need the support of the community to really raise the profile and voice of Asian and Pacific Islanders in the budget battle. And one of the ways that we can help fight against these budget cuts is through legislative visits, which we'll be doing on the second day of the summit, as well as participating in budget hearings. And I'd actually like to turn it over to Santosh now to talk a little bit about the May 3rd budget hearing that's going to be specific to immigrant programs. And she'll be able to tell you a little bit more about that.
Great. Thank you, Hala. Good morning, everyone. I'm Santosh Sriram Santana, and I'm the legislative advocate here in Sacramento with Asian Americans for Civil Rights and Equality. And I think Hala and Wendy have done a tremendous job in, one, outlining the conference, because ACRE is also a convener, but then going into the meat of it, which is advocacy, which is raising your voice, which is speaking truth to power. That's the reason I believe that we're all here doing this work and participating in this conference. And Hala framed it nicely in giving us context of what does this mean. Well, here's a conference where we're going to learn some skills and tools and dig deep and go for quality over quantity, and that's what the workshops are designed to do. We've asked presenters to make sure every person participating has learned at least 3 new advocacy skills. And the reason is being that we also have an opportunity to utilize what we're learning in a very real-world way. I think Sacramento is often described as not the real world, sort of similar to an ivory tower, but there is an opportunity that has become available to us, which I and Hala and Wendy urge everyone who is listening to participate. The CAPI CFAP hearing on the Assembly budget will be heard the same day that we are in Sacramento. And I shared this with Wendy and Hala, and they were about to change the date for this hearing. But I had gone in and said, we're having our summit at that day. Our folks are very interested in coming and participating. And they said, whoa, wait a minute. If you guys are going to come and participate, we will work it out and we will keep this date because we think it's important for the members to hear and see from your participants. So that alone says that you're important, what you have to offer is important, and they really want to hear from you. So on the 27th, the issues of CAPI, CFAP, and a new issue has been added, the recent non-citizen entrance program will be having a hearing on. And as many of you, I assume many of you have been to these hearings, and what will happen is right now we have been working with the budget committee staff to find out what their expectations are, what are our expectations, and how we can support this process. As Hala mentioned, the cash assistance program, the food assistance program, and the recent non-citizens program, they're all slated to be eliminated. We are focusing on CAPI and CFAP, and I believe other advocates will be focusing on the NRE program. But tentatively, the format is that there will be two panels, one panel to speak on CAPI and one panel to speak on CFAP. And within those panels, what we are looking for is a CAPI recipient and a CFAP recipient. And the community-based organizations who can bring forward someone, myself, Hala, Wendy, we want to work with the recipients to help them frame their message. It will be 2 to 3 minutes that they have to speak. Those are crucial minutes, and we want to make sure that their voices are lifted up in the best and the highest way possible. So we would like to, we want that real-world perspective, and we'd like to encourage folks that if you could think of a CAPI recipient or a CFAP recipient, to either get in touch with Hala and Wendy, because they are the co-chair, and they will work with me to help them develop their testimony. The other thing is that, we do this for a living, going up, testifying, lobbying, and I understand that there is some anxiety and sort of nervousness in a milieu that you're not familiar with. And so we completely understand that. And I think that's why we've asked for a format such as where there will be 4 presenters or 3 presenters on each panel, but the presence of the people in the room is equally as important. And as you see on the slide, we're asking folks to attend the hearing, to create that presence, to show that these programs are so important to us, that we are here at 4 and at 5 in the evening listening and wanting to know what happens to these programs. If we can have a critical mass show up in room 127 just to be present, just to show that we care about these programs, that in itself is also important. So there's a role for everyone. There's a role for the CAPI recipients who wants to speak. There's a role for the advocate who wants to speak. And there's a role for the people who just want to lend that quiet strength of support and solidarity to their colleagues as they move forward in this fight. So there's room for everyone to participate. The room is, I think, small. It may hold 100 people. And what I've been asked is that we will have 4 main presenters, and if everyone else could be what we call a Me Too. So it's as simple as getting up, saying your name, your organization, and asking the members of the committee to please do not eliminate these programs. So it's like 30 seconds. And so if folks we encourage folks to do that after the panels have spoken. If folks just want to be there in the presence, in solidarity, we encourage that as well. But mainly what we want is, if folks decide to participate, and we strongly encourage you to be in contact with Hala, because they did want to accommodate us to ensure our participation, and we want to make sure that it's orderly, that we know who's going to be there, who wants to participate, how do we place them in a role to participate, what are some different ways they can participate, and so that we know who's there and who wants to do what and what's the best place to put people in. So with that being said, we really look forward to this track. It's always been the biggest track, to participate, to come forward, and to support us in this hearing on May 3rd. And I am part of the Civil Rights track, and I will be including something very similar to our Civil Rights track about participating as well. Because the health track, they get it, right? Health, what these programs mean, but to a broader extent, this impacts all our communities one way or another. And so just wanted to share with you how we saw that day and that hearing unfolding and ways in which everyone can participate. Okay, that's it.
Thank you, Santosh. And I think right here we'll take a couple of questions that have come up. The first being someone who is participating in our call has a question about talking points for opposing these cuts at the budget hearing, and whether or not talking points will be made available to folks. So I don't know if Hala or Santosh, you want to field that. I'll also reiterate here that a lot of background materials will be included in your binders, which you will receive at the summit. So I don't know if Hala or Santosh want to add anything to that.
Sure, this is Santosh, and I do want to add to that. We have fact sheets on CAPI and CFAP about the programs. And if folks want, we could include some talking points. If the talking points are during your visits, I think that would be really helpful, because we are encouraging folks to talk about the budget cuts to CAPI and CFAP during your legislative visits. In the hearing, it is limited and it is controlled. And so there's a format for that we're trying to work within. So if folks want talking points on the cuts for their legislative visits, and we encourage everyone to talk about these cuts during your legislative visits, I'm sure between Hala and I, we can make that happen.
And just to add, in the email that you received yesterday about reminding you about today's webinar, we did include fact sheets on CAPI and CFAP that were created by the California Immigrant Policy Center. So that would be a great place to look about just for some more background information. One other question that we received, probably best to direct it to Santosh. Mm-hmm. What is NRE?
NRE is the Recent Citizen Entrance Program. And the governor's 2010-2011 proposed budget assumes a savings of about $55.4 million by eliminating this program. NRE recipients would otherwise be eligible for CalWork benefits, but due to their recent entry into the United States, they're barred. So approximately 24,000 recipients would lose eligibility. This is a very small group. They tend to be victims of domestic violence. Usually they are folded into other CalWorks hearing, but some of the advocates felt that they wanted this issue to be heard along CAPI and CFAP. So there's a face, and legislators can see the cumulative impact. because many of these people who are part of NRE also receive CAPI. So it isn't, these people are in silos. If you remove CAPI, if you eliminate NRE, if you eliminate CFAP, it's a triple hit. So, that is the thinking behind including NREs, and that's what recent non-citizen entrance program is. Hala, is there something else you'd like to add about that program that I may have not covered?
No, I think that was a great answer. Thank you, Santosh.
Okay, and just as a reminder for folks, if you do have a question, please use the question dialog box, which is contained on your control panel, and we'll try to get to as many of them as we can as time allows. So with that, we're going to move on to some logistics surrounding the legislative visits that will take place on day 2. As Hala mentioned, this section of the webinar is really geared toward our legislative team leaders. But if you have not attended the summit before, or are just looking to get a little bit more background information about what will actually take place on day 2, we invite you to continue to stay on the webinar. So we'll go ahead and get started on this last section of today's webinar. So this section will really go into more detail about what will happen on day 2 during the legislative visits. So as I mentioned previously, legislative visits will occur on day 2 of the summit, which is May 4th. All legislative team leaders will receive a lot of background materials to reference. There will be one-pagers on each of the Health and Human Services track priorities, the bills and the budget priorities. You'll get individual fact sheets on each of the bills we've decided to include in our platform. You will also receive the bios of the legislators you will be meeting with, and a set of team folders. So these folders are intended to be given to each of the legislators or staff members you will be meeting with. And that will contain, a little bit of background around the summit, and, kind of why you're here, and just some other great information about our communities. And a lot of what I should say here too as well, that a lot of this material is covered in the legislative team leader guidelines that Hala might have sent to you. And if you've been identified as a team leader, you should have already sent this information, so this should be in review. So we'll start talking a little bit about the team meetings. The first team meeting, as I mentioned earlier, it starts at 8:15 and over breakfast, and this meeting is really intended for the legislative teams to get organized. You'll want to use this time to identify the bills and the budget priorities you want to raise in your meetings with each of the legislators. You should to develop a team agenda. You should also try to identify who will speak on what issue and the order of the speakers. And you really want to make sure that everyone feels comfortable, in having a role during these visits. The other legislative team meeting will take place following the visits at 2:30, which will really just be an opportunity for you to debrief as a team, kind of review follow-up items, and determine any next steps that need to occur when you return to your homes. So the legislative visits, again, are broken up into 2 sessions, one starting at 10:30, going till about 12:30, and the other post-lunch at 1:30 to 2:30. The teams, I believe, will be based on geography, so and also based on the track. So if you're a Health and Human Services participant and you're coming from LA County, you will most likely be placed on a team with other advocates from that area. The track chairs, Hala and myself, have identified a number of targets for our advocacy, and we've given that information to the summit conveners to help with their scheduling of these appointments to really maximize the impact of our advocacy on day 2. So each team should be making approximately 3 to 4 visits. That may be a little, depending on the availability of each of the offices. There may be less, there may be more, but just for as a rule of thumb, we're expecting each team to complete 3 to 4 visits. The team leaders should also take note on kind of how the visits went, and we will include a report on legislative visits form for you to kind of indicate to us, what you talked about, what the legislators' stance was on those particular issues, and if any follow-up needs to occur. So we strongly encourage you to fill out those forms and get those forms back to us so that the track chairs and the conveners know if there's any next steps that need to occur with each of the offices that are the legislative teams have visited. There will also be a legislative team debriefing conference call that we would like all of our legislative team leaders to participate on. There will be 2 calls in May shortly after the summit. Unfortunately, right now we don't know when in May those calls will occur. And this, again, will be just a time to report back on how the visits went and kind of any feedback you have on the positions that the legislators that you will be visiting with will have. And as soon as we know the date, time, and the call-in information for the debriefing conference call, we will send that out to you. So just wanted to give you a heads up there. Now, I know many of you have probably participated in legislative visits before, but this is just a suggested format for you to follow. Of course, we'll start off with a basic round of introductions to include, your name, the organizations you're a part of, and where you're from. A little bit of background on the California API Policy Summit, which will be included in your team folders, the purpose of your visits, and of course the meat and potatoes of these visits, the discussion of the legislative and budget priorities, which Hala and I have recapped for you. And of course, you'll want to leave your meetings with some type of recommendation or the ask, whether that be to support a particular bill or oppose the cuts or, what have you. We just want to make sure that you are leaving the meetings with some type of recommendation for action for that particular legislator. And of course, you want to end your meeting with a thank you and also use kind of the closing of the meeting to discuss any kind of follow-up or that needs to happen, follow through with any requests, whether that be to set up another appointment in a district office, to send more information about the particular items that you discussed, or maybe inviting a legislator to a future event. So with that, I'm going to turn it over to Hala, who will facilitate the question portions. I don't think we've received any more questions, but I'm going to double check if you can just bear with us for a second. Sorry. And yeah, I think we've covered all of the questions. Fantastic. If, between now and the summit, if there are certain questions or, issues that come up, please feel free to contact myself or Hala. We, as co-chairs of the Health and Human Services track, are more than willing to field any questions that you may have. We look forward to seeing all of you at the summit, and thank you for participating today. I'll go ahead and leave our contact information up for a little bit so you can jot it down. And also note that the webinar presentation and a video of today's session will be available on the Asian and Pacific Islander American Health Forum website, the Immigrant Rights Project website housed at the Asian Pacific American Legal Center, and on the API Scan website on their conference page. And we'll make all of these resources available to you probably in the next week. So if you want to refresh yourself before the summit, we'll definitely have those resources available for you, and we'll let you know when all of those resources are available for your review. So thank you again for joining us today, and we look forward to seeing you on May 3rd. Thank you, everyone.
Bye.